Sometimes people think, well, if my dog's in pain, they're going to let me know. Most of the time, dogs don't do that.
Mm.
They just don't. Acupuncture causes a release of neurochemicals. Endorphins then are released by the body, and that blocks some of the pain signals. And the goal is to reduce the amount of medications that they need to be on. After 1 or 2 sessions, they definitely are noticing changes in their dog energy level. They seem like they're getting up a little bit easier. Their appetites improve. There are supplements that absolutely are essential. Nutrition, exercise, things like acupuncture and laser therapy. When you give them an in-monthly injection, and let's say there are negative side effects, we can't take that drug back. Like, it's in there. It's in them. Age is just a number.
Yes.
But the goal is just to keep them happy, joyful,
Yeah.
comfortable, moving well,
Yeah.
and hopefully they'll be with us for a long time.
Welcome to the DAFY podcast, the place where you will get expert-led and science-backed advice on dog health and nutrition. No more confusion and no more conflicting opinions. Just clear guidance to help you make informed decisions for your pup. Because when it comes to our dogs, they deserve the very best care. And we, as dog parents, deserve confidence in the choices we make for them. Let's meet an expert. Heidi, welcome again to the DAFY podcast. So great to have you on.
Well, thank you so much for welcoming me back. This is a wonderful space, and I really enjoy speaking with you. So this is a
Yeah,
great topic too. So
likewise.
happy to share with you.
Likewise, it's just so exciting. We had a fast conversation a few months ago, and I was like, you just have so much knowledge to share that we could have not done in one kind of episode. So we kind of reorganized a part two. And I'm really excited about today's conversation because that's something that myself personally I'm not very familiar with. So I think I'm going to learn so much
Mhm.
from you. And I think it's like a topic that is starting to become very popular, but I think people need to understand a little bit better and understand kind of like the story behind it and what's been done and who does it. Anyway, we're talking about like kind of like natural alternative therapies for not just senior
Mhm.
pets, I would say, pets that are going through some kind of chronic issue, if we want to call it that way. So
Absolutely.
we know that, that senior dogs can, in different ways, sometimes be in pain, right, for different reasons. So my first
Mhm.
question is, what are the kind of typical sign that a dog or a senior dog is in pain?
So there are some common things to look for. I will say in general, some dogs are very stoic and they're really, really good at hiding things, and others are much more obvious and vocal and they'll let you know. But some of the things we want to look for, certainly obvious things like limping. Limping is usually a sign of pain. And I think a lot of people don't always realize that, but absolutely, limping is something that should be considered like painful, and we want to investigate that. Other things, subtle things. Does your dog seem like they're hesitating at the stairs, not wanting to jump in or out of the car as much, or not wanting to get onto or off of furniture as much? Do they seem like they're just kind of laying around in their bed a little bit more, like hesitating and not being as social with the family? Those can all be signs. And certainly dogs who are out enjoying a walk and all of a sudden they seem like they're slowing down, or they sit down, or they just turn around and look at you like, I'm done. There's just so many little subtle things that we kind of have to pay attention and look at.
Yeah, absolutely. And why do you think like kind of like a pain in senior dogs is kind of often, and I've done a little post on Instagram about this. It's like often it's
Mhm.
been dismissed and it's been picked up by maybe like an annual vet check. And then when we do
Mhm.
pick it up, sometimes it's a little bit too late and the dog, like kind of has suffered, he's gone through the stage of suffering for many, many months before then. Why do you
Yeah.
think this is so dismissed by dog owners? Is that something that is not been picked up really quickly and maybe sometimes just blamed on old age?
Well, I think there's a couple of reasons for that one. I think that Pain can start at a very low level and it can start slowly. And I think sometimes, like when we see our dogs every single day, we don't always pick up on the little changes going on with them. Maybe we just don't always notice that they've been slowing down for a while, or if we're out walking them and we're focused on looking around, we're not necessarily looking at them and see them limping on a leg. So I think sometimes we just simply aren't observing them the way that maybe we should
Mhm.
be every day, just to make sure there aren't new changes going
Mm.
on. And I think just simply not realizing what some of those pain signs can look like in dogs. And again, sometimes people think, well, if my dog's in pain, they're going to let me know. They're going to hold up their leg and cry. Most of the time, dogs don't do that.
Mm.
They just don't. It's very rare that they cry out in pain. And sometimes they'll obviously limp, but a lot of times they will just power through walks, exercises, getting around the house because they want to be with us. So
Yeah.
I think there's lots of different reasons, but I think it's just they sometimes just don't give us obvious signs.
No, and they suffer in silence, and they don't like
Hmm.
necessarily. They're very strong. They would just like I have seen cases of dogs still eating, still drinking. I don't know if I
Yeah.
shared that example with you. I had a very senior dog a few years ago. He was with me for like 2 weeks. He was a little collie playing with the tennis ball all the
Hmm.
time in the garden for hours and hours. It looked totally healthy. A month later, had to be put down because he had like a terminal liver cancer, and I was like,
Oh.
whoa, I would say that must have been there for months, if not years.
Mhm.
But it's just, they don't show it to you. They're just very, very strong, unless they're like really ill that they can't move. And, then that would become like very easy to see. Yeah,
Absolutely.
yeah, it's interesting. And so, from your kind of expertise, right? So you are an expert when we talked about in two things that I remember of. There are alternative kind of like therapies to,
Hmm.
like support senior dogs going through this kind of pain. The
Hmm.
first one is acupuncture, and the second one is laser therapy. So
Hmm.
if we start with acupuncture, so first of all, is what is acupuncture? Because I heard of it so many times, but again, because I never needed it personally, I never researched into it, and I don't know much about it.
So I completely understand that, and I hear that quite a bit. An acupuncture needle is a solid, hair thin needle.
Mhm.
So it's not at all like the thicker, low, painful needles that are used for drawing blood and injections. So acupuncture needles then are teeny tiny thin, and the length is going to vary depending on the type of species that we are working on and kind of the areas of the body where we're going to be inserting needles into. But it's fascinating because due to the way the acupuncture needles are made, that really thinness to them, and they're very sharp. So usually when they're inserted, most dogs and cats don't even notice.
Mhm.
Sure, there can be some areas that are a little painful and they'll feel a quick little pinch as the needle is inserted. But once it's in them, it really doesn't hurt anymore.
Mhm.
And it's fascinating because the acupuncture points, we're just not randomly sticking them all over. I mean, I did go through extensive training in anatomy and where all of the acupuncture points are in the body or along the body. And so there are little clusters where there's nerve fibers. So we're definitely feeling anatomic locations when we are inserting them in. And when we insert them into the body, they sit there for approximately 20 minutes, give or take, depending on the patient and the condition. And at that point, the needles are stimulating basically the neurologic system, and they're causing a lot of changes in the body. So they're regulating pain signals in the body for sure. And so to me, that's just very exciting. And so at that point is when we see a lot of our patients relax during the process.
Yeah. And in what conditions like would be acupuncture used for? Like what type of condition does the dog need to have for the owner to say my dog needs acupuncture?
Good question. I see lots of patients for many different issues. For sure, the most common conditions that I treat patients for are my older patients who have a lot of arthritis in multiple joints. That's certainly the big one. Back pain, but back pain can be dogs of any ages. Certainly, supportive care with patients who have cancer or kidney disease or liver disease. It just helps them, it basically just helps them feel better, it can reduce their level of nausea, helps with pain relief, and they just can stimulate appetites. So I see all kinds of different patients. Certainly anxiety too. We do use it for anxious patients because that can help them relax as well. I do sometimes work with animals who have a paralysis of at least one limb, sometimes multiple, because it will help stimulate the nerves.
Wow.
Trying to think what else. Certainly some conditions affecting the skin as well, because again, we're trying to reduce a little bit of inflammation too. So there's a lot of uses for it. It's not just for pain and arthritis.
Yeah, that's so interesting. So even if like a patient is going through like a cancer treatment, so does he actually then work on the
Mhm.
nerves of the dog? And how does that reduce the pain? Like once the needles are inserted, just for me to understand, how was the kind of
Sure.
science behind it?
I'll try not to get
Too
too
technical.
too technical so everybody can
Mm,
understand. But yes, when you're inserting the needle in, we're not actually hitting the nerve because that would be way too painful and nobody would tolerate that. But it's close to where there are little nerve fibers. So it creates, or when that physical sensation of the needle going in, and usually we'll rotate it a little bit, it causes a release of neurochemicals in the body. It stimulates that release. So endorphins then are released by the body, and that helps everybody relax, feel better, kind of the good calming hormones. But again, those needles go in, and also once they're in, that biological process helps just to block some of the pain signals.
that's
So
interesting.
it's
That's
pretty
amazing.
fascinating.
Very fascinating. Like very, very fascinating. Wow. Yes, I didn't know it worked like that. Does that mean that acupuncture could potentially like remove the need of a dog going through like a cancer treatment or like like a really bad issue or health issue, to just remove the need for medication or maybe reduce the amount of medications they're getting, like painkillers and things like that? And is that like more of a natural way to support the dog going through that health issue?
Good question.
Mm.
And I get that question quite a bit.
Yeah.
So, acupuncture is not to be used in place of medication or cancer treatments because acupuncture itself is not going to
Mm,
cure anything.
mm,
We are making them feel better.
yeah.
We're reducing inflammation, reducing pain. Certainly, the goal is to reduce the amount of medications that they need to be on. Absolutely. And certainly lower the dosages of the medications used. I think that, especially if we're taking, let's say, a typical much older dog who has arthritis in multiple joints and is really struggling, I am a really firm believer in multimodal approach to
Mm.
that patient, meaning we're not just going to throw pain medication at them. We're not going to just say we're only doing acupuncture. That's a patient who needs multiple therapies, supplements, some medications, your acupuncture. We still want some movement. So acupuncture is part of, it's a tool. It's a very valuable tool that we add into the patient's mix. But I would say I don't usually use it as just the sole treatment.
Yeah.
Sure, there have been some patients over the years, but usually it works best by complementing the bigger picture and being mixed in with a bunch of modalities. But absolutely, we can use a lower dose of pain medication by adding acupuncture into the mix for sure.
Yeah, that's so fascinating. And do you work alongside the vets? So like, do you get like a referral from the vet to be able to do like however many acupuncture sessions, and do you work together with the vet to manage that normally?
I do work side by side with the veterinarians. I personally get referrals from multiple sources. Some come from veterinarians, some come from clients themselves. But when I'm going to see a patient, yes, I always request their veterinary records so I know I can just be
Mhm.
aware of what they're on, what's been going on, and then we work as a team as to just the best way to manage our patients and to make them feel comfortable and as happy as possible.
I love that. Yeah, I love that. That's amazing. And how long does a session takes? And what's the recommendation around the number of sessions needed for the treatment to be effective? Really.
Good question. So, when we're starting acupuncture, the sessions are cumulative. So, ideally, I recommend one session once a week for approximately 4 to 6 weeks. And then at that point, we assess how is this patient doing? How are they responding? Can we start kind of decreasing the session frequency a bit? And so that is the goal, then to try to slowly transition them to more of a maintenance schedule. And maintenance schedule is going to vary for everybody. I certainly have some patients, some older patients who come in every 2 to 3 weeks to see me.
Mm.
I have some who come in once a month. That I think that's pretty common to come in just once a month for a good maintenance session.
Mhm.
And then I have some who I see maybe 2 to 3 times a year or whenever their family just wants them just to have a little boost.
Yeah, like
So
a
it's kind
comfort
of all over
session,
the
isn't it?
place.
It's like for us going to the, I don't know,
Yes,
for a massage or like a good quality massage, like a therapeutic massage or a chiropractor appointment to get all our muscles work, make sure they are like, unblocked. Yeah, it's like that, but for dogs, essentially.
absolutely. And for those sessions, I'll kind of walk through what a typical session
Hmm.
is like.
Yeah,
The first appointment where I'm just meeting them, meeting the dog or cat. I just want to get a full history. So we do a lot of talking, let the animal relax, kind of wander around the room before I ever even put my hands on them, for them just to get acclimated. And that way I can just watch them and I'm talking to their family, but I'm also watching how they
yeah,
move. Because you can just pick up subtle things like watching how their weight shifting, all kinds of little clues. And then certainly feel them, do full body assessment, feeling for any areas of pain, heat, swelling. And then once the exam is finished and I come up with my treatment protocol, then I'll start gently inserting the needles into them. And the first one I always do is right on top of the head. That's just our generalized calming point. But again, most animals tolerate it extremely well, and it always surprises, I'd say it, yeah, it always surprises the
yeah,
family members just how well their animals are tolerating
yeah.
it. Half the time they don't even notice. So like I said, then the needles will stay in for approximately 20 minutes and I'll rotate them, uh, make sure, nothing's falling out because sometimes if they're moving,
Yeah,
if the animal's moving, the needles can pop out.
yeah.
I have a lot of patients that'll actually just lay right down. I have a couple of cats that fall asleep
Wow.
because, again, once you get all those needles in, it causes that massive release of endorphins, which helps them just to relax and feel good.
That is
And
amazing.
sometimes it can take a couple of sessions for them, to fully relax in the veterinary clinic with me being a new person to them, new treatment.
Yeah.
But I would say most of the patients leave wagging their tails and
Wow.
very happy. So it's rewarding for me to see that too. I love
I
it.
bet it is. But you are also a very calm person. I think you will transmit that to animals as well. Like you're very patient, very calm. I think that it's very important as well to be able to do what you do. Um, to have that
Thank you.
character, right? Like just the calming character. Yeah, very gentle. This is why I always said you're like the perfect, senior vet because you just
Well, thank
give
you.
that feeling to even owners. I think when I look at you as a dog owner, that's amazing, and it doesn't have any substances. The needle, it's just a needle, right? Like
It's just the needle.
needle. And
Just
how
the needle.
fine does it go in terms of like the skin?
So, good question. That is going to depend on, that's not a simple answer.
Yeah.
It depends on the animal, where exactly I'm putting the acupuncture needle in.
Yeah.
Let's say it's an area over the hip where there's a bit more muscle or a bit more tissue. That needle is going to go in a little bit deeper.
Yes.
If it's an area that's shallow, like closer to the ribs, or just a bony area with not a lot of tissue, that's going to be pretty shallow. I mean, it can be half a millimeter to sometimes like half an inch if
Yes.
it's a really if we're over like a meaty area of the hip.
Yes.
But it's not going in deep enough where because I don't want to be penetrating
This,
any vessels. We're not going in and hitting any organs or nothing like that.
yes. It's not like
Under
there's
the
no
skin.
blood coming out and things like that. It's
Mm-mm,
very
mm-mm.
superficial, essentially.
No. And every now and then, because there are teeny tiny little capillaries, little teeny tiny blood vessels are close to the skin at
Yeah.
times, every now and then there can just be a teeny tiny like drop of blood from where one needle was. But no, there is in generally no
Yes.
bleeding from
Yes.
acupuncture, nothing like that.
Yeah, no, that's amazing. I actually, you mentioned about vessels. I had a Japanese head spa massage a few weeks ago, and as part of that, they do a check on your scalp, and they put this machine, and you can see like your scalp in a monitor, and the amount of blood vessels that are very close to you. I was like, why is that red? Is that blood coming out? And she's like, no, that's normally like the blood vessels are just very close to your skin, and this machine is
Yeah,
just picking them out. And I guess it's the same for dogs. They're just very, very close to the skin, and sometimes it's a little bit
very
red. Yeah,
close.
interesting. That's so
Yeah, it's
that is so
fascinating.
cool. And in terms of effectiveness, when would someone, a dog owner or a dog, start like seeing improvements from like the amount of pain they're in? Like, is there a specific amount of sessions that they need to do before they start seeing like a significant improvement?
So I usually tell people not to start expecting a significant improvement until we're closer to like that loading phase,
Mm.
like 3 to 4 weeks of weekly sessions. Because I think to me that's usually when we start seeing more of the response. Now, that being said, I definitely do have some clients who have said after 1 or 2 sessions, they definitely are noticing changes in their dog, such as in energy level. They seem like they're getting up a little bit easier, or sometimes they simply want to, like their appetite's improved, just their alertness level. Those are usually the first types of feedback that I hear.
Yes, yeah, that's amazing. That's great. And when we talk about like acupuncture and science, I always bring in the
Hmm.
science in everything. How
Hmm.
much science is there around? Because I know that acupuncture it's Chinese medicine, right? That's where it comes from, really, doesn't it? When
That
was that invented?
that's where it originated. So that was invented in China thousands and thousands of years
Yeah.
ago. And they started using it more about energy transfer and just using it in humans. And then slowly they started using it actually in horses. And very slowly then it's kind of spread throughout the world. And there are still some schools. There's really two different trains of thought with acupuncture now. Is there are some schools that teach practitioners more the Chinese traditional way of doing acupuncture, which is all based on energy, moving energy and healing. And then we have a lot more schools now in the States. I'm not sure about Europe, but we do have a few schools here that are focusing on more what they call medical acupuncture.
Hmm.
The acupuncture points, the interesting thing is the acupuncture points that we all learn, regardless of what school you go to, they're the exact same.
Yeah.
It's just all based on anatomy. Well, the only difference is the way of thinking. And the medical one is more just focusing on the scientific changes that happen to the body, like the neuromodulation, like physically what happens when you stick the acupuncture needle into the body and the physiologic changes that happen.
Yeah.
So I've actually done training in both because I wanted a good blend. And, again, the needles, the placement is all the same.
Yeah.
It's just a theory. I am a veterinarian, so I love the science aspect that fascinates
Yeah.
me, but I also like blending kind of both
Yes,
worlds.
absolutely. Yes, absolutely. That's brilliant. I love that. Yeah, I love that. I love that you've completed as well both training to see like what the main differences were.
Hmm.
And try and bring it into like, okay, from a science perspective, like how does that work? Are there any like studies on dogs specifically that or are the studies more focused on humans as opposed to dog, or horses, for example, as opposed to dogs, for example?
Most of the stuff, well, first of all, there is some scientific literature research out there.
Yeah.
However, there's not a lot of organizations that want to fund that type of
Mm,
research. Therefore, a lot of it has not been done.
mm,
And that has been done is more in people and not so much in animals. But we know that the acupuncture points are the same in humans versus
right.
animals. It's just simply based on anatomy.
Yeah.
And if you know the anatomy of the species you're working on, you can find the acupuncture point.
Yes, absolutely. See, it's similar to like, when we talk about, like how similar humans and dogs are in terms of DNA that we're sharing and things like that, right?
Hmm. Yeah.
More money have been spent on human studies. That's the reality of it. That's probably why we're such in a big confusing world in nutrition for dogs, right? Because unfortunately,
Yes.
the big studies are done, unfortunately, not unfortunately, but there is not many studies that actually share, okay, what's better from a kibble perspective, raw perspective of gently cooked. There are not enough studies that tells us that to make us feel confident that one specific type is
Yeah.
better or not, because there hasn't been any studies, and to do studies you will need to take dogs, and it's like then you need to think about welfare of the dogs as well. So that's the hard part of it.
Yeah.
And it's not easy
It
to do a
is.
study unless you like do it in that way, right? Because a study done in a house
Hmm.
or just through feedback from dog owners is not the same as a control study in a specific environment and things like that. So yeah,
Correct.
but it's good to know that there are more, like there are human studies, right, that have
Yes.
that show the like effectiveness. So that's amazing.
That show the efficacy.
Yeah, the efficacy, exactly. And so that's acupuncture. And then the second one you've mentioned, is that something that you actually actively practice, laser therapy?
So I do some laser therapy. Acupuncture is more the primary modality that I reach for, but I do still think therapy is beneficial as an add-on. I don't ever use it as just the only thing I do for
Yeah.
patients because I don't think it's effective enough to induce change.
Yeah.
But where the laser therapy shines is that it can help reduce some inflammation. But I should back up. What the laser is it's called a few different things like low level laser, or sometimes known as cold laser
Mhm.
therapy, meaning it's not a surgical laser, so it's not burning any tissue. It's just you can literally apply it against your skin and you maybe feel a little warming sensation, but it does not hurt it. And so the laser light is at a near red to infrared wavelength of penetration. And so the laser light is going for the cells and it's just doing like a cell turnover. It's reducing inflammation. So that's what I use it for. When I said that my acupuncture needles have to stay in patients for about 20 minutes. That's usually when I pull out the laser probe and then I'll apply the laser to areas that I know are painful, to the back, to joints. I'm always asking clients like where they're noticing issues. And so where I feel on my patients, it's a great time to be using the laser. And they all tolerate the laser again because it doesn't hurt.
Mhm.
It doesn't hurt at all. You just have this device that's sitting on your skin and it has to sit there and move around.
Yes.
Now, sometimes people ask about hair, and because our patients are obviously very furry,
Yeah.
So if they're very, very furry, and actually if they have a darker pigment,
Yeah.
so like a black coated dog can actually absorb more of that laser energy just because there's more melon, more pigment in the
Interesting.
hair. So we just have to be aware of that and just turn it down a little bit. But it doesn't hurt anybody. It just again helps to further reduce some inflammation. So I added in as part of a good
Yeah.
package for a good session.
Yeah. So your recommendation would be to then use it together as opposed to just use laser therapy on its own, use it with as well as acupuncture if needed.
In my opinion, it works better by being added into
Yeah.
something like acupuncture.
Yeah. Yeah.
Absolutely.
That's amazing. And I guess to know how to practice with laser therapy, I guess you had to do a study at university to be able to do that, or how does that work?
So veterinarians and veterinary technicians,
Yeah.
veterinary nurses are all able to practice laser therapy. They do have to undergo some training for it because just like anything, it's not appropriate for
Yeah.
everybody. We don't ever want to be lasering over lumps, bumps, any type of cancer because it actually can make it increases cell turnover, so it can make cancer grow.
Yeah.
We do not want to ever be using laser therapy in areas that we're unsure exactly what's going on. And so that is a lot of times if I have a new patient coming in for a sore joint, that's a perfect reason of why I like to see radiographs, x-rays first
Yeah.
to make sure that we are truly just dealing with something like arthritis instead of like bone cancer.
Yes.
Because we don't want to be causing any stimulation over cancer.
That's an interesting point, of course, because it's laser, isn't it? And it's, yes, it
Mhm.
will create the opposite effect. That's interesting. That's not something you will know straight away. Yeah, that's very good. So I am a dog owner and I have a dog with arthritis and I go to my
Mhm.
regular vet and they say, okay, just take supplements and reduce the amount of walking time or maybe just split it across two walks. Like these are the things that normally a regular vet would recommend. If I wanted to integrate acupuncture or laser therapy if needed, how can an owner go about, saying, okay, I want to incorporate that into, the plan of keeping my senior dogs pain free as long as possible?
Great question, and you're right. And it really depends on the type of veterinarian you have, what they are exposed to, what kind of training they have.
Mm,
Because sadly that still happens here too
yeah,
a lot, where somebody goes into the vet and their vet just says, here's some pain medication. So I do think that it absolutely is something that as dog, cat, pet owners, we have to advocate for our animals. And it's good for us to learn what's out there. Yes, there are some wonderful veterinarians that will say, here's all kinds of different things that we can try and do, but they're not all going to do that. So I think as the dog owner, if you go in and your dog is diagnosed with arthritis, I think asking about trying a mix of things. Yes, pain medication, proper pain medication absolutely has its place and is necessary in moderation. There are supplements that absolutely are essential. Nutrition, exercise, things like acupuncture and laser therapy. Yes, we need to kind of be the advocate for our dog
yeah,
and ask what options are available in that area.
yeah,
And that being said, I am a big believer in not trying everything at once. So we do want to kind of space things out a little bit just because if we're all of a sudden starting five different modalities with our dog, we don't know what's working and what's not.
yeah.
So I'm usually a fan of let's try something for a couple of weeks, see if there's any pluses or any minuses, and then let's add something else.
Yes. Yeah, I completely agree with
Does
that.
that?
And then you like, if that works, then we can do more of one and then bring in something else and see how that works.
Yes.
Absolutely. Yeah, I
Yes.
completely agree. And one question I had, I've seen a while ago, like loads of news about, and I don't know if that's linked to it, Librella. Do you know Librella? So
Yes.
there are loads of dogs in the
Yes.
UK that get that injection. I believe it's for arthritis, isn't it? I believe. I think I had a client once that she was like a vet receptionist and she was like, yeah, my dog is 13. he gets every 6 months his Librela injections. And then I saw a lot of, news about it from different experts, right? Mainly holistic
Mhm.
vets. They were like, do not use Librela injections. They're really bad for you, la, la, la. What is your view on that? Like, is that just crazy news or just trying to or what's your view?
Well, that is a hot
Yeah,
topic right now here in the States as well.
still.
And
Okay.
I will say my opinion has changed, and right now I am very on the fence.
Mm,
At first, when I found out about it, I was super excited about it.
yeah.
And we were trying so many patients on it. People were saying they were noticing significant improvement
Mm,
in their dogs. And then all of a sudden, all these reports of some really serious side effects were coming out. And then I had a lot of clients say, you know what? It just stopped working.
mm.
So I started becoming really cautious. And when you give them an in monthly injection, and let's say there are negative side effects, we can't take that drug back. Like it's in there. It's in them. We can't we can't give them anything to reverse
That's
it.
it.
So that's kind of scary in itself.
Mm, yeah,
So I personally am not recommending or pushing that one now
yeah,
like I
yeah,
was. I think if we have somebody who has tried everything and there's sort of not a lot left and they want to try it and they know the risks, fine. Let's try it. But it is not one of the first things that I personally am recommending right now.
yeah, yeah. I do
I think we
agree.
need more information.
Yeah, I mean, I am of the same view because I don't have yet an issue with arthritis with Rusty, but for me, I am like that with fleas and tick medications. I hear loads of
Mhm.
reports, loads of side effects and things like that. And I use the topical one, Rusty, during tick season and flea season.
Mhm.
And I am
Mhm.
generally, I have seen cases with my eyes of dogs that had these side effects. And I'm scared to think what because you're giving a tablet now, or there is actually the yearly injection nowadays coming out, and that thing that
Mhm.
really scares me. It could be that Rusty doesn't have a reaction from it because he's strong enough, he can deal with it. But if a dog does get a reaction, that's the scary part.
Yeah.
How do you go and reverse that at that point? That you're gonna have your dog ill on medication and like that for a year or until that goes away from the body. And that's the thing that
Yeah.
is quite scary, isn't it, to think about it? Like it lasted so long in the dog's body and the
Mhm.
bloodstream that just makes you feel a little bit reluctant. Well, it's a drug at the end of the day, still,
It is.
that's why I'm like,
I com
yeah,
Yeah, I understand that completely from a pet owner's perspective
yeah,
and from the veterinarian's perspective. I
yeah,
mean, because if we give them something, we can't take it back. So then we're just stuck trying to manage
yes,
whatever negative side effects that the dog or cat is dealing
yes.
with. And yeah, some of those are can be really scary.
Yes, yes, absolutely. I just wanted to like bring it up because I was like, I have never asked anyone that on any interview so far. And I was like, we're talking about arthritis. I'm just gonna ask you the question. No, that's amazing. And yes, I think these are the two main ones we wanted to cover. Are there any other natural therapies that you perform or you know of that are effective that you would like dog owners to kind of be aware of?
I mean, acupuncture, of course, is what I'm passionate about. I see the best response with it, the best patient tolerance too. But I think massage
Yeah.
it can absolutely be helpful. Something like that. We're not giving anything orally, but just a nice gentle massage that anybody can do at home. You can just use the palm of your hand, like if you're going over the back, just doing nice, gentle, slow circles over the hips. We're not trying to do crazy deep tissue massage on our animals. Just like if they wake up and they are sore, just a nice slow massage can help get that blood flowing, the muscles just warming up, relaxing a little bit. So something like that, people can certainly try at home.
Yes, I totally agree with that. We did a little run with Rusty like a couple of weeks ago, and I could see he loves running, but I always get worried that I'm like, he's almost 6 years old, and I don't want to do it more than maybe once a year. He loves doing it, but he's not the one making
Hmm.
the decision to do it all the time. But I could just hear the next day when he, when we woke up the next day, he wasn't limping, but you could see that he just needed a little bit of, joint massage, just very gentle, because
Yeah.
he overworked his muscles. And I think it's so effective. The next day was totally fine. You're not doing like a deep tissue massage, but it's just a gentle,
Yeah. Right.
relaxing one there. He was just falling asleep basically whilst I was doing it. It was cute. But you could see at least he
Lucky
enjoyed
boy.
it, exactly. But yeah, I'm the living proof that that works basically. Amazing. That's amazing. Yes. So is there anything else you'd like to mention before we close off?
Just that I think don't be afraid of acupuncture.
Yeah.
I definitely have talked to many clients over the years who are scared because they think needles, they think there's no way their dog or cat's going to tolerate it, that it's going to hurt, or that it's not going to work. But just try to be open-minded. I think your dog or cat would really surprise you with how well that they will tolerate it. And I always encourage pet families to be into the exam room with me in the treatment room when I'm doing the acupuncture,
Yeah.
because I do think that helps comfort the patient. So just being with them and just being open-minded.
Yeah.
We have so many wonderful modalities and things to be trying to give our dogs and cats just a more comfortable, happy, joyful life.
Yes. Especially in the senior years, right? I don't
Especially,
think I will
yes.
ever go to anyone else other than you. And as he's getting older, I keep looking at him and
Uh,
go, Dr. Heidi, don't worry. Honestly, but it's so beautifully said, because they are
Mhm.
getting older, and you can
Mhm.
hear the slow down in different ways, and it's like they become little puppies again, right? Like they have more needs, like than they did
They
as
do.
adults, right? And so you're kind of looking at them instead of the wing in the house, which actually can happen when they're senior as well. But it's just more like
Mhm.
give me that love. It's more calming as opposed to like crazy
Yes.
puppy like attitude that you normally would get at like 3 months old, which is it's really beautiful.
Yes, it definitely changes,
Yeah,
but
exactly.
age is just a number.
Yes.
But we just the goal is just to keep them happy, joyful,
Yeah.
comfortable, moving
Yeah.
well, and hopefully they'll be with us for a long time.
Absolutely. Wow. You
Yeah.
are the living proof of that. How old is Frank now? 17?
Oh my gosh, he is turning 17 this
I
weekend.
cannot believe that. Oh my, are you gonna do a little
I
party
actually
for
can't
him?
either. We are gonna have a tiny little dog birthday
Oh,
party for him.
17. Oh my, oh my word. Honestly, 17, that's an amazing, amazing age. And he's doing pretty well when I see him on social media with you. He's just looks
He
so
is.
happy.
He's definitely slowing down,
Yeah.
but he's a happy little guy who is enjoying life
Yeah.
very much.
Wow. 17. I cannot believe it. Honestly, that is an amazing, amazing age. Yeah. I definitely like some pictures from the party.
Okay, okay, will do.
Amazing. Just one question. If anyone, I always say that even if we recorded an episode already, if anyone wants to get in touch with you that hasn't watched the last episode and they want to, either they're in your area or they want to just ask you some questions, maybe a consultation or something like that, where can they find you?
Sure. So, couple of easy ways. Certainly on Instagram, it's at Aging Pause Vet. People can reach out to me that way, or you can certainly send me an email at mvaneedles@gmail.com, and I can send you that can be frequently misspelled, so I can send you that
Yeah,
if you
and I
want.
can pop in the show notes as well afterwards. So that's fine.
Perfect.
Amazing.
Perfect. But yes, always happy to hear from people, and it's always such a joy to talk to
Yeah,
you. Thank you
honestly,
again
likewise.
for welcoming me back.
Yes, there is so much to learn from you. I knew I was going to love it. I absolutely loved it. So thank you so much for jumping on. And yeah, it's always a pleasure talking
Thank
to you.
you. You as well.
Thank you
Thank
so
you.
much. Thank you for watching, everybody, and we will see you on the next episode. Thank you for watching. If you found this episode helpful, follow us on Instagram. And if you want first access to DAFY, join our waitlist now. The links are in the show notes.